We are live. Welcome to this live. Mm-mm-mm. Welcome, welcome to the live. Welcome, welcome, welcome. Mm-mm. Okay, thank you for joining in. Welcome to the live. Hello, everyone. Let me know if you can hear me. Slagozi Adindu forced to drop a chat. Thank you for tuning in. Please let me know where you are watching from. Welcome, everyone. Welcome to the live. Thank you for the like. Welcome to this community. I really like to meet with everyone coming across this live. This Roblox Echo. Hello, Roblox. Good morning, Adidu. Please, may I know where you are watching from? Where are you watching from? Win Thank you for tuning in. Win Where are you watching from? Thank you. Welcome, everyone. Please like and subscribe if you are not subscribed yet. And if you are yet to double tap on your screen, that way the system gets to notify more people. I know we are in different time zones, right? Okay. And I believe this time is actually a good time for most subscribers, audience, and potential audience in different parts of the world, in the United States, in Kenya, South Africa, in probably in the UK, Canada. So, but let me know where you are watching from. I believe I'm audible. Please confirm that you can hear me. You are very important to me. That's why I'm here at this time. I just had to come on this live to let you know how important you are. Chiagoz, Chiagozi or Adindu. I hope I got the pronunciation. Pardon me. Good morning. Where are you watching from? Are you in Africa? Um, what part of Africa are you watching from? And if not, which part of the world are you in right now? And Roblox. Thank you all for the likes. Thank you so much. All right. So one of the things that I understand is that as we move on, different people come in at different times, different points in time in the course of the live stream, and then hopefully we have more audience and more people to join this conversation. And that's one thing that is common to everyone, health. And I'm passionate about your health, and that's one of the reasons I keep showing up. Okay. If you are here to join this community, kindly look for the subscribe button. Interestingly, when you subscribe, you need to note that the options are there for notifications. When you tap on that particular icon, you will find out that there will be options for you to get all notifications, some notifications, but when you tap on get all notifications, that way you are able to access any post, access any short video, any long form video that I release. And when I come up live like this, you will definitely be notified. But if you don't do that, you may not know when next I come up live. So kindly double tap to like and then subscribe so that you can be part of this community. I'm sure in some parts people are asleep, some parts of the world, some people are still asleep. Okay, people are coming up to waking to the morning. Okay, and some people are already in the night. But I believe for everyone that will be coming across this, you will find this live stream interesting. So I was just thinking that what should we be talking about? You can come up with any topic, anything related to your health. In fact, sometimes I even share my YouTube experiences, okay, my YouTube journey. But if there is something that is common to every one of us, if there is one thing that is health, health, your health is as important to you as it is important to another. All right. We all have these treasure, this valuable gift that has been given to us by God, and we have responsibilities, responsibility to take care of our health. I'm sure you've heard that before. Health is wealth. Health is wealth. Do you believe that? Let me know in the chat if you believe that health is wealth. Okay. Interestingly, some people equate wealth to money, equate wealth to finances, but it's more than that. The same way I say that your life is more than the work that you are doing or the job that you are doing. So you must be conscious of this truth, that your life does not consist in just a few things. You know, your life is a complete one. You are a spirit, you have a soul, and you live in a body. I'm sure you've heard that before. So, what do you think health is? Do you believe that health is wealth? And if you do, let me know in the chat. Sometimes I know that there are some delays in messages in the chat. So I'll be waiting for your comments, your chats, and kindly please respond to the poll. We have a poll there. Please like and subscribe. Let me know if you have liked this live stream, and then let me know what you think when it comes to health. But I like to really meet with each and everyone joining the live. Let me know where you are watching from. Let me know if you can hear me. Hope I can get your feedback. It's a pleasant morning from this side. What time is it in your location? Welcome, welcome, welcome. Thank you for joining the live. Where are you watching from? Let me know where you're watching from. You are so important to me, each and everyone. Let me know where you're watching. Win oh. Let me know if you're still here. Adindu and Roblox. All right. So if you say something is priority, that means it's important. You know, there are people that talk about how important someone is to them when it comes to relating, relationships, and it could even be something related to work. You know, somebody may see you, your employer may see you as important to what they are doing in the company or the business, and so you are important to that company. They see you as a very valuable person, you know. And if you are an employer, not just an employee, you will understand that there are some people that you see as key persons when it comes to the activities of your company or your business, and you want to ensure that you let them know, let such individuals know that you appreciate them, that you value them. Okay. And we apply that principle in life. Okay. But how many people actually see the value, pay attention, to the health that they have. And it's such a gift that you have life. It's such a gift that you can talk. It's such a gift that you can think. Such a gift that you can hear. You know, some people do not have that opportunity anymore. Some people have long gone, passed on. Okay, but as long as you have life, you must appreciate that life. You must celebrate it. You must value it. You must ensure that you pay attention to it. So if something or someone is important to you, you will give it attention. You will give that individual attention. Do you agree with me? I'm sure you do. You know, if something or someone is important to you, you will give that thing attention. You will give that person attention. So the question is, how important is your health to you? How important is your health to you? You're going to grade it from 0 to 10. What number, what value will you attach to your health? Let me know in the chat what you think. What value, what number will you attach to your health on the we grade it from 0 to 10? How important is it to you? Okay, and I will actually know how important by the time and the attention that you give to your health. So currently the question is, how much time, how much attention are you giving to your health? In fact, there are many people that could be joining this live at this time, but someone somewhere may be in the hospital and they are not able to even think about uh, coming on social media uh, because they are just not able to. Maybe their energy level is low, they are on some special treatment. Okay, so but you have that opportunity now. I don't know where you are watching from, but as long as you're able to touch your device, your phone, your tab, your laptop, your desktop, and you're able to watch, that means you can see. And if you can hear me, that's another special gift. Okay, but how much care, how much attention do you give to your health? And I like to emphasize the real definition of health. There's a general definition when it comes to health. The World Health Organization has defined health as a state, is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So it's a complete definition. And that definition now includes, for me as a family physician, there's the spiritual, even for medicine generally, there's an understanding that there is the spiritual side to our lives. And you cannot deny that spiritual side, which is foundational. So you are not just expected to pay attention to your body. You, as an individual, you have a spirit that you need to pay attention to. And as long as that spirit is strong, it doesn't matter the challenges that you may face or may be facing currently, you are able to overcome. But if you have a weak spirit, if your spirit is weak and you can easily be overwhelmed by situations, circumstances, then that's a faulty foundation that every other thing can happen on. For example, I usually use this example. If someone gets a diagnosis of diabetes or hypertension now, there are two individuals. Their response or responses may differ, definitely, because they have different backgrounds, different understanding, and you know, different priorities. Somehow, their responses, their reactions may differ. Okay, one may get into depression, become anxious because of such a diagnosis, while another may just see it as a challenge and ready to face it. So, how do you see life situations when things happen? How do you get to a point where you can stand, where you can see it as okay, the cup is half full rather than half empty? And it takes a relationship with God and responding to that relationship, fellowshipping with Him, understanding the Word of God, the thoughts of God, the plans of God for your life as an individual that can help you to navigate such a situation. I believe you are following. Let me know in the chat uh, your thoughts on this discussion. Let me know your thoughts. Thank you for tuning in. Kindly let me know where you are watching from. Thank you. Thank you for responding to the poll. Thank you. Thank you so much. Remember to double tap on your screen if you are yet to. Double tap to like the live. And please let me know where you are watching from. Let me know where you are watching from. I really like to meet you. You know, you are very important to me. Yeah, I'm here because I want to talk to you. So let me know where you're watching from. And let's keep the conversation going. Mr. Eddie is here. Hello, Mr. Eddie. Hello. Mr. Eddie says, I welcome. Welcome, Mr. Eddie. Please have you liked and subscribed? Have you liked and subscribed? Let me know in the chat. Welcome to this LD community, health conscious people here. So our emphasis usually is on health matters, um, wellness, and lifestyle. And of course, we have many people who are also content creators who join the live, and we share YouTube experiences, how we are navigating the road. Okay, and then next year, no, this next month, we'll be marking 4 years uploading videos on YouTube. You know, that's interesting. So it takes some commitment, it takes some time and attention to talk about marking 4 years as a YouTube content creator, and not just as a medical practitioner, but a medical practitioner and a content creator. Okay. So it's been an interesting journey, really. Okay, but let me know in the chat if you also create content on YouTube, and what content do you create? Please let me know in the chat. Mm. Are you a content creator or you just enjoy the platform and the contents that others making available? So what interests you on YouTube? Of course, I've mentioned the fact that health is something that is common to each and every one of us. And then the emphasis on the three components, talking about your spiritual health, your mental health, and social health. Okay. So we look at how your spirit needs to be strong and be in shape to handle the other aspects of your health and your life. So, what you feed yourself with, what you feed your heart with, will determine the state of your soul. So, what are you exposing yourself to? Whose company are you keeping? What information do you allow? Interestingly, in this age of technology, so many information available uh, live, like we are doing right now. You know, you can just get updates on anything happening in any part of the world. So the important thing is understanding that whatever you expose yourself to, whatever you're watching, whatever you're listening to, whatever you think about, of course, before you get to thinking, you have exposure, some form of level of exposure to some information. So you must be sure that you are exposing yourself to the right information. And that's what we do on this channel. You can get relatable, practical information on health matters. So you need not to be confused. You need not to feel that there's a whole lot of information. Of course, I say that you need to have interactions with your own doctor, very important, apart from getting this general information. Okay. And as much as possible, try to make it understandable, relatable. Okay. So, what you need to be doing to ensure that you strengthen your heart, your soul, is looking out, seeking for the right information. There's something I usually say about having any, someone may be worried, may be anxious about developing a medical condition like diabetes or hypertension. The fact is that someone around you has diabetes or hypertension does not automatically mean that you will get hypertension or diabetes. In fact, that you have a parent that was diagnosed of hypertension or diabetes does not automatically mean that you will be getting any of those. Okay, so because there are other factors, developing hypertension or diabetes is not limited, is not solely connected to genetics, not connected only to genetics. Now, if you understand that, that helps you to position yourself and to do the needful when it comes to prevention. Because there are things that we call, there are factors that we call non modifiable factors when it comes to health, medical conditions that an individual may develop. Using hypertension and diabetes as examples, you know, your race, your age, There's really nothing that you can do about that. We increase in age. Our race has been determined from before we were born. Okay, so those may not be modifiable, but you must look at the things that can be modified, the things that you can do to ensure that you are not tilting towards a medical condition, a disease or disorder, as the case may be. So, what are your practices? What are the things that you do? What do you take in? What are you consuming? Now, talking about the physical now, what's your diet like? What do you drink? Those are very important factors and the areas that you need to look at as an individual when it comes to preventive measures. So, when are you going to start paying attention? When are you going to start giving your health the needed attention? Okay, some people actually wait till complications uh, have developed before they try to start doing something about it. Of course, it's better late than never, but prevention is still better and then cheaper than trying to cure a condition. And interestingly, medically speaking, there are some conditions that are just to be managed for life. So, if those conditions can be prevented, why not do something? Why not put measures in place for yourself as an individual to prevent those medical conditions? So, your health is priority, and you must, as an individual, learn to prioritize your health. That's your wealth, that's your treasure. In fact, if you are not medically fit, one of the things that people do, I'm sure you know about this, if you have at any point in time, been asked to provide a medical report, whether for study, maybe you are applying to a school, studying abroad, or you are traveling to get secure a job, before you are fully employed, there is the need to assess your state of health. You can see how important this is. How important this is, not just to you as an individual. Your state of health also affects others, your friends, your family, the community, your employer. If you are not fit health-wise, no matter how brilliant you are, no matter how effective you are, no matter how valuable you are, all that may be reduced to nothing if you are not fit health-wise. So, what are you doing to ensure that you maintain your health if you are fit, and then you build on it? What are the things that you need to be doing? Because sometimes there are updates on health matters. So you need to also be current. You need to know what's happening in the world. And that's one of the things that we do on this channel. We talk about current happenings, things related to health, everything around it, trending issues. So, what are you doing as an individual? Are you giving time and attention to your health? When was the last time you had? Okay, we are back. Thank you. Thank you for staying tuned. That was a quick break. Okay, welcome back. Thank you. Let me know if you can hear me. Oh, Miss TikTok girl is here. Hello, Miss TikTok girl. Welcome to the live. It's good to have you here. It's a very good morning from this side. How is America today? How are you doing and how was your day? Okay, sorry about the network. I had to take a quick break. We've been here for about 30 minutes or so. I hope you can hear me now. Hello. Can you hear me now? This video needs to be stable. Can you hear me now? Thank you for the sixth like. It's confirmed that you can hear me. Am I audible? How you doing, Miss TikTok girl, and everyone joining in at this time? For those that have been here, welcome back. For everyone just joining in, welcome. You are important to me. So let me know where you're watching from and what time it is in your location. What time is it in your location? And if you are yet to subscribe to the channel, please subscribe and remember to like the live. I really like to meet with everyone that's coming in, joining the live, whether you are an old timer, a subscriber, or you are coming across the channel for the first time. Welcome, welcome, welcome. May I know where you are watching from? So I was just going through some statistics. Yesterday, I had the opportunity to speak on hypertension, and it's one health condition that I am passionate about. Considering the fact that they are growing, uh, there's a growing prevalence when it comes to hypertension and even diabetes. Okay, and there is the prediction that the numbers are going to so multiply, and if there's no action, if there are no steps taken to actually deal with this menace, and then uh, a lot is going to be happening in the health sector. It's not limited to a particular city. It's a global threat. It's a global threat. So hypertension does not discriminate. Okay. And then in Mumbai, it's actually said that 30% of the population in Mumbai, India, is actually uh, dealing with hypertension. 30%. That's huge. And the population is said to be about 12 million people. So that was like a study done for people over the age of 30. 30% of the adults have hypertension, and about 140,000 individuals were found to have elevated blood pressure. Okay, and then many of those are receiving treatment. But I need to mention here that it is said from the research that has been done that nearly 20% of hypertension cases are actually in young adults and linked to stress, smoking, and alcohol. I need to read that again. That's of the 100% of cases of hypertension in Mumbai, 20%, 20%. So that means 2 out of 10 are actually young adults. So you can see that the effect or this condition is showing up more in the younger age group. So it's not hypertension or diabetes, they are not just health disease conditions that affect people in their old age. So it should be a false belief if you are still thinking that hypertension is for those old people. No. I mean, research has shown and is showing that more people in the younger age group, younger adults, are developing hypertension and diabetes. That's interesting. So it doesn't matter the city you are in. There are statistics relating to your city. Okay, if you want me to check that out for you, you can just let me know where you're watching from, what city you are in currently. Okay, and I can let you know what uh, the numbers are, what the statistics really is relating to hypertension or diabetes. And the fact is that these conditions are, have been linked to stress, smoking, and alcohol. Remember when we started on this live, I started talking about the fact that there are some non modifiable factors, factors that puts or makes an individual to be at risk of developing hypertension or diabetes. There are factors including the race, genetics, and age, which none of us can actually do anything about. Okay, those are not factors that you can change, but there are modifiable factors. and the emphasis on lifestyle, diet, activity, these are modifiable factors. There's something that you as an individual can do. There are things that you can do as a family, a community, to prevent the development of hypertension or diabetes. Interestingly, some of these uh, recommendations are actually important. They are also important in individuals who have been diagnosed of hypertension or diabetes. So it's not about um, something that is meant for a select few. It's something that each and every one of us must be involved in. Aligning ourselves, choosing to give time and attention, doing the needful when it comes to uh, our health. Miss TikTok girl, let me know if you are here, if you are still there, let me know. And then for those who are just coming across the live, welcome to the live. We're talking about your health um, being priority, and how do you actually, as an individual, how do you prioritize your health? Do you give it the required time and attention? How important is your health to you? Have you ever felt like doing something, and there are days that I've had such experiences, that I've thought about content creation, sitting in front of the camera, shooting a video, uploading, editing, uploading, doing something. But my body could not just get to work. Have you been there before? Okay. So one thing or the other could have led to that. Possibly uh, going through some stressful activities already. Um, Talking about work related activities. And then you find out that without proper rest, adequate rest, one is not just able to do the next thing or other things on or in the plan. So, have you been there before? So, you can see that you can only be effective, you can be productive as long as you are healthy. Your productivity level can reduce significantly once you are losing your health. And I pray that you will not lose your health. But plus the prayers, you just need to do the needful. We need to do the needful. We need to give the necessary time and attention to our health. So I was asking earlier, when was the last time you had a proper medical check? You don't necessarily have to wait till you have a symptom in your body before you visit with your doctor. So, what time, what attention are you giving to your health? And if for Mumbai, 20% of cases of hypertension are in young adults, and research has shown that these conditions in those individuals have been linked to stress, smoking, and alcohol. So we're going to look at these three. Now, stress is common to all. Stress is common to all. Thank you for the seventh like. Thank you for the seventh like. Let me know who is just joining us or who gave the seventh like. That's a perfect number. Thank you so much. Welcome to the live. If you are just joining in, and I will really appreciate if you can let me know where you are watching from. I really like to meet with you. You are important to me. Okay, that's why I'm sitting here to talk to you. So I really appreciate a feedback from you. Everyone just joining in. Hey, Cinti District, where have you been? Cinti District, wow. Good to have you here. Been a while. Good morning. Good morning. Wow. It's been ages. Are you still creating content? Please let me know. Are you still creating content on YouTube? How have you been? I think there's this issue of not getting notifications for channels that one is subscribed to. Okay. And the secret is still in kindly click on all notifications. So when you check your subscribe button to the channel, you tap on it, you will see the options for the type of notifications you want to receive. So when you click on it, you will see that all notifications at the top. So just click on all notifications. That way you will be getting notifications for all the activities on the channel. So I need to check my settings for your channel because I think I've had to do that for some channels to check and be sure that on see all notifications, get all notifications, which is better so that we don't miss out on the information that we are getting from um, the different channels. So thank you for joining in, Simply District. Yeah, you say yes. How are you doing? I'm doing great. Thank you. It's been quite demanding on different sides. Everything that needs time and attention. Okay. So, what we are really talking about priorities and the need to prioritize our health. And I said earlier before you joined about how people prioritize and value and pay attention to things that are important to them, to the people that are important to them. I'm sure you have one or two persons that are important to you and that you value. So you give your time, you give your attention to such persons. But the question is, how much time, how much attention are you giving to your health? Most times people wait till until they have symptoms or until complications have set in before they decide to go for a medical check. When was the last time you had a blood pressure check? Thank you for the second vote. Thank you. I hope we can have more votes in the poll. Thank you for liking and thank you for subscribing. It means a lot to me. Thank you so much. Cinti District says last week, wow, deserve a clap. Very good one. So I'm sure um, you may not be able to tell us the details, but that has done something to you. That's helped to probably expose the things that probably you have been doing wrong, or and help you to see the things that you have been doing well and how to intensify and improve. on areas that will help to strengthen your health, including diets, including your activities, including your mental health, So it's a good one that you're able to go for a medical check last week. That's interesting. That's highly commendable, Cynthia District. So how do you feel doing that? How do you feel doing that? Yeah. One of the statistics, one interesting thing about differences between a man and a woman is that when it comes to healthcare and health seeking behavior, it's better. I mean, it's seen to be better in women than in men. Okay. Sometimes it's a man's wife that's pushing him or encouraging him to get go for a medical checkup. Okay. And so for most men, uh, in a general note, they don't seek medical attention until probably the situation has gone out of hand. Okay, so I'm not sure if your husband went with you for the medical check, if he had his own medical check. You know, these are areas that we need to be checking. Thank you for joining the live. Welcome, and let me know where you are watching from. Please let me know where you are watching from. This is very important. That's one of the ways I get to know my people, whether you are old or new. And the more we interact, the better I get to know you. I hope I'm. Let me know if you can still hear me. Let me know if you can hear me. Am I audible? Oh, thank you. Thank you, Cynthia. Thank you so much for the feedback. Yes, I can see your comments, your chat. In question, you say, I feel good. Cynthia says, yes, there's a way you feel when you have done. Interestingly, people get anxious sometimes because they don't know what their body. Some people are actually afraid of what may be discovered. That's one of the reasons why some people don't want to come to the hospital. Okay, so when you see someone that is coming intentionally to the hospital, not because they have a symptom, but because they just want a check. I mean, you should respect such individuals. Respect them. Now, those are the people that are really paying time and attention. They are prioritizing their health. So we don't really know what you value, what you prioritize until we see the time and the attention that you are giving to it. You don't value someone in a relationship until we see the time and the attention that you're giving to them. So, feeling good, I mean, naturally, you should feel good. You should be happy with yourself. You have done something uh, that was needful and is needful, and then it helps your mind to be at rest. You're not anxious. You're not wondering what's going on in your body. Okay. So I'm so happy for you, Cynthia. And then keep it up. I want to encourage you to keep it up. You should have it once in a year, except by your doctor's recommendation. If you have other uh, times within a year that you need to have some checkups, then you should follow your physician's recommendations. So men always give excuses of not going based on their busy schedule. Yes, now is that not true? Since the men are making money, I mean, they're trying to make sure that the family is okay, the wife, children, other extended family responsibilities, and all. So, is that not a good reason not to go for a medical checkup? What do you think, Cynthia? Excuses. Really, they are excuses. So, how long are you going to be excusing yourself from doing the needful? As a man, if you are there watching, what where was the last time you had a medical check? What are you afraid of? Actually, some people are really afraid of what um, maybe running a test may discover. But interestingly, there are some cases that are just like borderline diabetes, hypertension, cholesterol, abnormal levels of cholesterol. If you are able to just pick them, if your doctor is able to pick early, then you can be helped appropriately. I mean, with lifestyle modifications, some of these things can be handled. But if an individual does not show up at the time that those conditions are on the borderline, and then there's a progression to a full manifestation, blown hypertension, diabetes, dyslipidemia, overweight, obesity, then the individual will now need to deal with the condition, symptoms, and then even complications in some cases. Of course, in many cases, men always give excuses of not going based on their busy schedule. So men are busy, especially Nigerians, right? People are hustling and trying to make ends meet, right? Okay, but money is important. Simply because I can imagine how much it costs you to run tests, of course, to see doctor. I don't know whether it was in a private setup or a public setup. No matter where you had the medical checkup, if it was a diagnostic center, you had to pay for some services, consultations, running tests. I mean, even if you needed to have a follow up, those are areas that we also need to look at. Okay, some people don't have that uh, opportunity to fund. I'm not sure we have anybody like that on YouTube. Okay, because if anyone can get on YouTube, you can subscribe. You have data. It's not free data. You have to pay, or you have a phone. You recharge your phone. You make calls. You do a lot. You are employed, you are getting well paid. So there's no excuse for not doing the needful. I mean, having basic tests. Sometimes your doctor may tell you, okay, you can do this series of tests at this time and do some other series at another time. Okay, but there are some that are urgent, and your doctor will let you know which of the tests are urgent. And of course, they are all important. Then you can follow up with others later. So this is an important aspect that we also need to consider. Most people are paying out of pocket. It's just in few cities or countries that the government is already subsidizing, and they are operating a healthcare system that favors the people. So if you have a healthcare package, insurance package, it may be easier than if you have to pay out of pocket. All right. So these are very important areas that we should also be talking about. So not just that individuals have responsibilities, communities, families, non-governmental organizations, the government, there has to be more commitment a show of commitment to the lives, the health of the people. Because really, it's the people that make up the city, the country. So as long as you have a healthy community, healthy people living in a city, healthy people living in a nation, then you can't be sure that that nation will go far. That nation is going to grow. But the more the weak, the more you have more sick people, people dealing with chronic health conditions that may even make them disabled or limit their productivity, then you can imagine all the things that are going to suffer, the economy of that nation. So, Cynthia District says, as a wife or partner, we should always push to go. Some people don't like hospital, but they fail to understand that health is wealth. This is powerful. I'm going to screenshot this. This is a very important statement and point that you have made, Cynthia. Who else is with us? Let me know who else is with us on this live. All right. So, as a wife or partner, we should always push to go. That's commitment. So, that's part of saying that this man is important to me, important to my children, to our children, important to the family as a whole, to the community, important to this nation, important to life, because you really don't know what that man is going to become fully, the plan of God for that man, and all that God wants him to do and be in life. How much can a person do, even if the person is a man of God, a pastor, how much can they do if the vessel that they need to do the assignment that God has given to them, how much can they do if that vessel is weak? When I say weak, I mean physically, because there's a level of weakness, meekness that we must show for God's strength to work in us, for us to be really be able to carry the grace of God and do what we need to do. But when it comes to the physical, God does not want us to be weak physically. In fact, He's ready to supply strength um, where we are weak. So that's why there is the provision for healing uh, with the Word of God, in the place of prayer. Okay, so I believe in divine healing. Okay, so if we position ourselves correctly, not hurting our bodies, not doing the things like they found out that in Mumbai in India, that people are going through high levels of stress. People are engaging in smoking. People are engaging in alcohol intake. And these three uh, lifestyles, that way of life, have actually been linked to the development of hypertension in 30% of the population. Is that not something shocking? And if you are not careful, these numbers may increase. Some people don't like hospital, but they fail to understand that health is wealth. I mean, we need to. This is an understatement that health is wealth. Let me pin this message. Okay, so I just pinned it. So you don't actually have to like something. You don't have to like a place. But if you need to get something done and it's important for life, for your health, then why not? So, as a partner, as a spouse, as a friend, as a family, a relative, you know, as a colleague, you need to encourage someone around you that you know will actually benefit from uh, doing the needful when it comes to seeking healthcare service. Okay, having a diagnosis or going to the hospital does not automatically mean that the person is going to die. Doesn't. In fact, the advantages are there. I've mentioned the opportunity to pick up some conditions early enough for them to be managed. And these conditions can be reversed. But some people, there's already a long term effect, diagnosis is made, and then proper management can be started. But if nothing is done in terms of taking steps, if diagnosis is not made, if no management is coming up, then complications may set in, and that can progress and lead to death. So, health is wealth. It's something that we must treasure, it's something that we must value, give time to it, pay attention, do the needful. Cynthia, you touched my heart by saying that you actually went for a medical checkup last week. Okay, so that should encourage somebody to also do the needful. If you have been thinking about it, it's time to take action. It's time to step up to do the needful. And how happy are you going to be if by the time all the checks are done, you are certified free and fit? So the wealth is one special wealth that brings in other forms of wealth. Your health is your wealth, and an important one at that. Simply District says fund. Fund, yes, you can use health centers, though Nigerian health centers aren't helping. Okay. Now we need to get deeper into this conversation. Simply, you say fund, yes, funds very important when it comes to healthcare, for consultation services, for uh, laboratory services, nursing services, physiotherapy, drug prescriptions, pharmacies. You just need funds. Everything is connected to funds. Now, you say you can use health centers, primary healthcare centers. Primary health centers are almost in every place in Nigeria. Okay, so find out in your own city, in your own area, which one is closest to you and how well can you utilize it. Of course, there are questions, there are concerns about the adequacy, the resources available, the manpower, you know, available in such centers. In fact, there are actually some centers that um, there are nurses, even though they may not be a doctor, expected that is a doctor, but they can handle some basic healthcare matters. That's where training comes in. That's where recruiting people comes in. And there has to be a commitment on the part of the government to increase these services because the benefits are there, especially for those that live in rural areas, in places that are far. If there are bad roads, access to such places may be limited. But when you have people that are trained living in the same setting, in the same area, they're able to handle some cases and refer appropriately. So, what do you mean by Nigerian health centers aren't helping? You, you want to share with us some experience? Okay, just a minute. I can still see your chart. Let me know why you say some though Nigerian health centers aren't helping. How do you mean? So what do you mean by Nigerian health centers aren't helping, Cynthia? Do you have any experience that you want to share with us? Or anyone with any experience or experiences with primary health centers in Nigeria? Okay, for those who are just joining in, welcome to the live, and remember to double tap on your screen to like the live. You can see the poll is there. Please like and subscribe, and you can respond to the poll to let me know um, if you have liked and if you are subscribed. Thank you so much. Okay, Cynthia District says, for instance, going for kids immunization cards and other things are free, but they will always request for money. That's an interesting one. Okay. Now, the things that are free are supposed to be free, really. They should be free. But there are some services that may not be provided for, may be provided only for those who are paying. Now, you need to find out and be sure which ones you need, you are not expected to pay for, and the ones that you need to pay for. And you can clarify what exactly you are paying for. So that's where communication comes in. So when you engage with any healthcare provider, like service provider at any level, that interaction is very important. Communication and clarity is very important. So there's a way one can communicate and get the correct feedback and information. So when you get that, you now relate it to what you know and what is expected, and then we can challenge in ways that we should challenge when things are not being done appropriately. Okay, so that could really be discouraging. In fact, there are people that are not possibly able to afford paying for uh, some of these vaccines that we're talking about. So, immunization generally free on the national program on immunization. But there are some that are not available, but may require individuals to pay for. Okay, so you must be sure which one you are not you are not paying for, which one you are expected to pay for. So with that, you can then approach the appropriate authorities to lay your complaints. Okay. Yeah, I understand. Sometimes you may find yourself in some settings where you can clearly say that people are playing games and doing things in an unacceptable manner. Okay. So I understand that. For instance, going for kids immunization cards, other things, everybody will always request for money. Wow, always request. There are different ways. Hmm. There are different ways. When you talk about request, they are requesting for you to pay for a free service. Then that's not something acceptable. Okay, and like I said, the appropriate authorities should be notified. All right. Of course, you engage them first of all, and ask them why they are trying to collect money for a service that is supposed to be free. But there's another way people are just trying to seek support. This thing that they also do during some seasons, especially around Christmas. You know, people in some places will put up a box and then write something around it on it and expect visitors to put in. I'm not sure if you have seen that happen around you. Companies not just limited to hospitals. Students also do it. They expect people to gift them. Okay, so giving a gift is different from being requested to pay for a service that is expected to be free. So I agree with you that some people actually play games around these things, and that's one of the challenges, one of the things that make people to want to avoid visiting the hospital or certain places. But the fact is that there are options, and you can always go somewhere else if where you are currently is not giving you the necessary um, response or service that you deserve. Okay, Cynthia says they aren't well paid based on salary. And that one I think it's a general thing now that applies to different levels of professionals. Some people will say it's not only medical field, but you can see. I'm aware that people travel from different professionals, from different uh, walks of life. People travel out of the country, the jackpot syndrome. So people feel that they are not being well paid for their level of experience or what they are offering in their services. Okay. And looking at the cost of living, economy, and all. So you want to compare what you are earning and with what you are spending and see is there a balance. Looking at the time. When you talk about doctors giving time to work, giving all their best to providing services, you know, the skills and all. If the necessary remuneration is not done, I mean, that's where this continuity, the exodus, will just continue. So I understand that aspect of people not being well paid. Of course, there are opportunities to other sides, other ways to earn, and that's talking about multiple streams of income, which we must also talk about. All right, so these are various challenges when it comes to uh, the healthcare services. So, like I said, we should talk about the. Thank you, Cynthia, for engaging. We should talk about stress. You know, stress. So, some workers actually feel stressed, and I've been there before. Yes, the overwhelming numbers in terms of number of number of patients to one doctor. Staggering statistics. You can't even be thinking about it now, talking about it. Imagine one doctor to thousands of patients. Okay, so if on a day, a clinic day, the doctor has to see hundreds, and there are other areas of life and responsibilities for that doctor, may even be within the same system. How does such an individual cope? So whether it's even at the health center where you have nurses, community health workers, you know, extension workers, you may have limit limitations in the numbers available, and that way pressure may be on them, you know, and some may not be able to cope. So talking about stress, it's just our individual reactions to any form of disturbance, tension, arising in situations. So, and there are different factors that may be responsible for this. Maybe internal, maybe external factor, stress. All right, and this is something that people are going through, and some people are able to cope and have their coping strategies to handle stress. But for people that are not able to cope, to deal with stress, they have a progression to burnout, and they have a progression that can eventually lead to developing a mental health illness. In fact, some people have attempted suicide, some people engage in suicidal thoughts from just moving from stress to burnout. So, what are your thoughts, Cynthia? Stress. What is stress and how do you cope? How do you deal with stress? If you are just joining us, let me know where you are watching from. Hope you can hear me. Let me know if you can hear me. Okay, my audio is fine. My audio is fine, right? Am I audible? Testing, testing, testing. Okay, it's better this way. It's better this way. Okay, welcome back. Or welcome if you are just joining us. Cynthia says, I gift them, but it shouldn't be generalized. That's it. So talking about gifts, just like you have mentioned, you have a choice to who you want to gift, as God puts in your heart, or as you think it's fine to do. So let's talk about stress as a factor when it comes to developing hypertension. Of course, I hear people say a lot. I mean, during consultations, some people say, "Oh, doctor, I was really stressed. Maybe that's why my blood pressure is this high." And that's true. Sometimes people's blood pressure become high from experiencing some level of stress. Okay, at a point, we all need stress at a level. We need to perform tasks. We need to do a project. We are having expectations from one thing or the other. Those are levels of stress, different levels of stress that are involved in such with such experiences. However, um, high level of stress and chronic stress isn't healthy. We need to get that clearly. So, what is your reaction towards stress? What gets you stressed? There are different factors that we call stress factors. For some people, majorly it's emotional factor, relationship challenges. Some people psychological, could be from anywhere. I mean, business challenges, academic challenges, career related challenges. Okay. Some is physical, people being physically abused. Those that's a level of stress. That's a type of stress factor. Okay. But the question is, how do you cope with stress? How do you handle stress? What are your defense mechanisms for handling stress? Because, like I mentioned, some people progress from just being stressed to becoming, going to chronic stress or becoming burnt out. And you must be careful, you must be sure that you are not going into burnout. And if you are already in a position where you need assistance, of course, you should get the needed assistance for yourself. So now there is increasing demand. People want to increase their financial strength, capacity. So there's also a need for most people to step up in their physical activities especially relating to work demands. Okay, so people do several things, get involved in several businesses, and sometimes these are stressful situations. So people end up eating badly, some skipping meals, some overeating, some eating late at night. Okay, so these are some of the factors that may be responsible for the development of chronic hypertension. Statistics showing about 30% of those diagnosed of hypertension in Mumbai, in India, are adults. And of that percentage, 20% of those numbers are young adults. And these conditions in them have been linked to stress. We'll talk about the other factors later, okay? May not be in this session, okay? But stress is one thing we must be addressing now, okay? We must be moving from stress to rest. We must be ensuring that we are getting adequate rest, that we are helping ourselves in our minds to be rested emotionally. You know, you need that serenity of your heart, of your environment. You need peace, you know, for you to experience that healthy life that you deserve. Okay, but if for any reason you get overwhelmed with stress, and it can lead to anxiety, can lead to depression, can lead to suicidal thoughts, can even lead to panic attacks. Okay, and then um, the individual may now need support. People get into chronic burnout. Some other people get into um, suicide. So, what are your coping strategies? For some people, withdrawal. Some people, meditation. Some people go jogging, exercising. Some people get engrossed more in social media. So there are various ways by which people cope. But you can also meditate, which is very important. Meditation on the right things, in the Word of God, and getting that rest in your heart that God is on your side and you and God can undo this. Okay, so this is a very important aspect when it comes to handling stress, your coping strategies. You must know and you must recognize, you must have as life will definitely in different ways uh, show up with stress. So, what are the things that stress you? What are the stress factors that you, as an individual, has identified in your own life? Let me know in the chat. Let me know in the chat. Welcome once again. If you are just joining us, and then if you are a returning subscriber or viewer, remember to let us know in the chat. Let's know in the chat. All the way from India. I was just talking about India, Rajesh. We're talking about Mumbai. Mumbai. Hello. Hello, Rajesh. Welcome to the live. Thank you for joining. You know, I need to be. I remember Rajesh said, Rajesh, you promised to be consistent uh, audience, part of the audience on live. Okay, so I'm expecting that as I show up, you also show up. You know, I remember you saying that um, you want more videos, more live streaming sessions, and so uh, that means you should have your notifications. You know, click on the subscribe button, and then you see the notifications in different categories. You just go for the uh, get all notifications, and that way you will be getting uh, the necessary notifications. Remember to double tap on your screen, and thank you if you have done so. Let me know in the poll if you have liked this live. Thank you, Rajesh. Rajesh Spicy, long time community member. Mumbai, it's Hyderabad. Okay, please break this down. What's the meaning of this Hyderabad? What does it mean? I'm not sure. I, I understand this language. Okay, so please let me know. What do you mean by Mumbai is Hyderabad? Oh, it's your state. That's interesting. Okay, you mean this? Okay, the city in India. Okay, okay. Mumbai is different states. Oh, it's different states. Is it not part of India? Hyderabad is city in India. What about Mumbai? Mumbai is it a different country? Mumbai is it not in India? Okay, so Rajesh, there are interesting statistics from the information I gathered on Mumbai. Okay, I said that about 30% of the population are dealing with hypertension. Okay, it's part of India. Okay, but you are watching. Are you in Hyderabad now? Hyderabad. Okay, thank you for confirming. Mumbai is also in India, but Hyderabad and Mumbai, how close are they? Let me see. Mm. Okay, not that far, right? There are different cities. So what's the distance? What's um the journey like driving or by train from Hyderabad to Mumbai or from Mumbai to Hyderabad? Rajesh, what was it like? Like an hour drive, 2 hours, 3 or 4 hours? Interestingly, it's morning in India. It's is it around 9 a.m., right? 10 in India. 16 hours. Wow. That's not close at all. So you mean between Mumbai and Hyderabad, driving 16 hours? Mm. That's interesting. India is so populated. I mean, interesting. Okay, so people need to pay attention, more attention to their health. All right. So stress, alcohol, and smoking have been implicated in the development of hypertension in adults in Mumbai. Okay, so thank you for the vote. Thank you for liking and subscribing. Okay. So what do you think about this? Talking about lifestyle, how is it in Hyderabad? Are people really active? when it comes to physical activity, bicycles, do people exercise? Do you have gyms? And then talking about the stress level, uh, people are really, really stressed from work or relationship matters, business. So, what are the different causes of stress in people in Hyderabad or in India? Oh, okay, Rajesh says it's 10 a.m. now. That's interesting. I think that's between. I can't see this. So that means between 2 a.m. and 2 a.m. and 5 a.m. or 6 a.m. Maybe 2:30 to 5:30 a.m. Would be a good time to live stream for those who are not in the African region. Right, because most cities are either morning and then night in some places. So thank you for the feedback, Rajesh. Rajesh says, which state are you from, Doc, in Africa? From Lagos, Nigeria, West Africa. That's where I am from. That's live streaming from now. Okay. But originally, talking about state of origin being Ogun State, but live streaming from Lagos, Nigeria. All right, so let me tell you the time. So that means if I had started even earlier and ended the live, you might not have joined, but it would have been probably night or late night in your place. So it's 5:27 a.m. It's a Friday in Nigeria. That's the 29th of August. So that's the time. So we've been on this live for close to 2 hours now. Quite a number of people have been here. Adindu, Roblox Echo, Win OO, Mr. Eddie, Miss TikTok Girl, Cynthia District, and of course, Rajesh. Rajesh, I hope you will be able to over the go over the replay or the live at the end of the session. So in about 5 minutes, she'll be closing on this live to take a break. I'll catch up again later today, hopefully. And by God's grace, moving into September, we should be having question and answer session, and that is going to kick off in September. Um, the days will be communicated. Specific day for the question and answer will be communicated to you. So watch out. So you can ask your question, uh, maybe medical related or um, related to my YouTube journey, which is also very important. I like sharing it. It's really very interesting. Going to be 4 years being on YouTube in the coming month, and it promises to be more interesting season. and I hope YouTube will do something to encourage the channel for growth. Hopefully, it's so interesting. Rajesh, I can see you dropped something here. Thank you, Rajesh. Thank you so much, Rajesh. Thank you. This is well appreciated. Thank you for your support. Mhm. Thank you, Rajesh, for your support. I do not take it for granted. This is interesting. It means a lot to me. Sometimes people think, oh, what's the doc? Doesn't really need support. This channel needs to grow in numbers. We need to spread the word. We need to let more people know that we are a growing community, health enthusiasts, and we talk health, which is important to everyone, and wellness, lifestyle, as we interact as a community. Then um, there are no limits to what God is going to be doing with this channel. So let's keep hope and be expectant as we grow. All right. So always let me know what you are interested in uh, each time, and as much as possible, I'll try to meet up. So Rajesh, thank you so much for your support for dropping this, and thank you everyone who is here. Kindly appreciate Rajesh on my behalf. Just let's celebrate him. Thank you for the support. Mhm. Thank you for the support. So, looking forward to increasing super chats, super stickers, super, and the memberships. So, people should start showing up with more support, and we need this to do more. Thank you so much, Rajesh. I remain committed to giving my best for the to the community. So because of time differences, I may be unable to join live sometimes. Yes, I understand. Understand. Depending on your schedule and your availability, right? So thank you for your commitment and looking forward to seeing you again soonest. Thank you so much, Rajesh. Okay, Doc. Bye for now. It's time to work. Catch you later. All right, Rajesh. Thank you so much. Have a great day. Enjoy yourself and greetings to your family. Thank you so much. And I'll be closing um, on this point. Thank you so much, everyone who tuned in. You are well appreciated, and I believe you learned something in the course of this live, and we will keep moving and growing. Cynthia Districts, I'm sure we'll catch up later. We'll get to see again soon. Thank you, and bye for now.